Welcome students. Today we will discuss a very important concept, that is the concept of disorders of human male reproductive system. Many disorders occur in human male reproductive system, but the main disorders which occur in the human male reproductive system, which we will be discussing in this lecture, are as the first disorder is the prostatomegaly. So the first disorder we will be discussing of the human male reproductive system is the prostatomegaly. Now, what happens in the prostatomegaly? This is the diagram depicting the prostatomegaly. This is the prostate gland. It is the prostate gland. And if by some or the other reason the prostate gland undergoes enlargement, as is shown in the diagram, if it undergoes enlargement by some reasons, then this condition is known as the prostatomegaly. So the first disorder is the prostatomegaly, in which the prostate undergoes enlargement. When the prostate enlarges, it is the enlargement of prostate gland. It's the enlargement of prostate gland. This disease is usually age related. People in their 60s and 70s more often develop this type of the disease, in which you will see once the prostate gland enlarges, it blocks this is the urethra, it's the urethra, and this is the urinary bladder. The urine from the urinary bladder passes out through the urethra, but once the prostate gland enlarges, it blocks the urethra. So such patients face very much problems on passing the urine out of their bodies, and sometimes they fail to completely pass out the urine from the urethra, which results in dribbling. Dribbling occurs. In dribbling, you will see the patient, even after urination, passes out some drops of the urine. Even after the urination, there is tendency of dropping out of some of the urine through the urethra. This is known as dribbling. And when we talk of the treatment of this disorder, usually a surgery is done to remove the enlargement, or to sometimes remove the whole prostate gland, so that the patient feels comfort. So this is the first condition which we call as prostatomegaly. Now the second type of the disorder is the benign benign prostatic hyperplasia. It is another type of the disorder of the human male reproductive system related with the prostate gland, in which the prostate undergoes benign cancer. Benign cancer. When this prostate gland undergoes benign cancer, it again results in the problems related with the prostate gland. Sometimes it may even undergo prostatomegaly due to benign prostatic hyperplasia. Sometimes it is written in abbreviated form. BPH means benign prostatic hyperplasia. So it is the benign cancer of the prostate gland which leads to many problems, and in this case also a surgery is done to remove the prostate gland. Now another disorder is the impotence. Impotence. Impotence is the inability to maintain the erection of the penis long enough to engage in the sexual intercourse. So it is inability to maintain the erection of the penis. So in impotence, we see that the person fails to maintain the erection of the penis long enough to engage in the sexual intercourse. It results in sterility. After that, there is Quietism. The fourth type of disorder is In Quietism. Quietism is a disorder in which the testes remain in the abdomen, they fail to descend down into the scrotum. So, if these testes, which should have been in the scrotum, they fail to descend down into the scrotum, this condition is known as inquietism, inability of testes to descend into the descend into the scrotum. So it is another type of the disorder in which the testes fail to descend down into the scrotum, and this condition is known as inoncoidism. It results in the sterility. As you see that the spermatogenesis, that's the formation of the spermatozoa, can only occur in the scrotum, as the temperature in the scrotum is feasible for sperm formation, but it is not feasible in the abdomen for sperm formation. So if the testes fail to descend down into the scrotum, which occurs during the inoncoidism, then no spermatogenesis will occur and such persons will be sterile. And after that, there's another disorder which we call as sterility. Sterility. Sterility is the failure of the person to what we call as produce the spermatozoa, or to produce spermatozoa which are not able to fertilize the ovum. So in that condition, we say that either there occurs azoospermia or oligospermia. Azoospermia means almost no spermatozoa are produced, or almost no spermatozoa are found in the semen. Almost no spermatozoa are found in semen. This is the azoospermia, and it's also a cause of sterility. Then there is oligospermia. Oligospermia means very few spermatozoa. Very few spermatozoa are found in the semen. This is the oligospermia. It can also lead to the sterility. Then this impotence, it can also lead to the sperm sterility, and anoncoidism also leads to the sterility. So these are some of the main disorders of the human male reproductive system. Hope that you have understood these disorders, and if you have any suggestions regarding much more what we call as development of this channel, you can drop your suggestions in the this comment box.